Welcome to NCLEX Practice Hub, your ultimate resource for NCLEX preparation. In today's video, we will go through 20 NCLEX practice questions focused on nursing fundamentals. These questions will help you test your knowledge and critical thinking skills. Make sure to watch until the end. Question 1. A nurse is caring for a patient with a new colostomy. What is the first priority in postoperative care? Is it A. Preventing infection, B. Maintaining skin integrity, C. Ensuring patient hydration, D. Providing nutritional support? The correct answer is maintaining skin integrity. Maintaining skin integrity around the stoma site is crucial to prevent infection and ensure proper healing. Question 2. What is the primary purpose of therapeutic communication in nursing? Is it A. To gather information for documentation, B. To build a therapeutic nurse-patient relationship, C. To instruct the patient on medical protocols, D. To manage the patient's emotional state? The correct answer is B. To build a therapeutic nurse-patient relationship. Therapeutic communication helps establish trust and rapport, which is essential for effective patient care. Question 3. Which of the following is a priority when administering medication through a nasogastric NG tube? Is it A. Checking for tube placement, B. Flushing the tube with 30 milliliters of water, C. Crushing the medication, D. Positioning the patient upright? The correct answer is A. Checking for tube placement. Ensuring proper placement of the NG tube before administering medication is critical to prevent complications such as aspiration. Question 4. A nurse is assessing a patient with chronic obstructive pulmonary disease, COPD. Which finding requires immediate intervention? Is it A. Barrel chest appearance, B. Use of accessory muscles for breathing, C. Clubbing of fingers, D. Respiratory rate of 24 breaths per minute? The correct answer is B. Use of accessory muscles for breathing. The use of accessory muscles indicates respiratory distress, which requires immediate intervention. Question 5. During a blood transfusion, a patient starts to experience chills, fever, and back pain. What is the nurse's first action? Is it A. Notify the physician, B. Stop the transfusion, C. Administer antipyretics, D. Check the patient's vital signs? The correct answer is B. Stop the transfusion. Stopping the transfusion is the priority action to prevent further adverse reactions. Question 6. What is the primary benefit of using evidence-based practice, EBP, in nursing? Is it A. Increases patient satisfaction, B. Reduces healthcare costs, C. Improves patient outcomes, D. Enhances teamwork among healthcare providers? The correct answer is C. Improves patient outcomes. Evidence-based practice ensures that nursing interventions are based on the best available evidence, leading to improved patient outcomes. Question 7. A nurse is teaching a diabetic patient about foot care. Which statement by the patient indicates a need for further teaching? Is it A. I should inspect my feet daily, B. I should use a heating pad to warm my feet, C. I should avoid walking barefoot, D. I should wear shoes that fit properly? The correct answer is B. I should use a heating pad to warm my feet. Using a heating pad can cause burns or injury due to reduced sensation in diabetic patients. Question 8. A patient with pneumonia is experiencing shortness of breath and has a respiratory rate of 30 breaths per minute. What is the nurse's priority intervention? Is it A. Administer prescribed antibiotics, B. Encourage deep breathing and coughing. C. Position the patient in high Fowler's position. D. Increase the patient's fluid intake. The correct answer is C. Position the patient in high Fowler's position. Positioning the patient upright helps improve breathing and oxygenation. Question 9. Which statement about pain management is correct? Is it A. Pain is subjective and varies among individuals. B. Pain can always be objectively measured. C. Pain intensity is consistent across cultures. D. Patients always exaggerate their pain levels. The correct answer is A. Pain is subjective and varies among individuals. Pain perception is subjective and can vary significantly from person to person. Question 10. A nurse is planning care for a patient who is at risk for pressure ulcers. Which of the following should be included in the care plan? Is it A. Reposition the patient every 2 hours. B. Massage bony prominences. C. Keep the skin dry. D. Apply a heating pad to areas of redness. The correct answers are A. Reposition the patient every 2 hours. C. Keep the skin dry. Explanation: repositioning helps prevent pressure ulcers by relieving pressure, and keeping the skin dry prevents moisture-related skin breakdown. Question 11. Which of the following is a sign of fluid volume overload? Is it A. Dry mucous membranes. B. Hypotension. C. Bounding pulse. D. Weight loss. The correct answer is C. Bounding pulse. A bounding pulse is a common sign of fluid volume overload due to increased blood volume. Question 12. When caring for a patient with a urinary catheter, which intervention is most effective in preventing a catheter-associated urinary tract infection, CAUTI? Is it A. Using sterile technique during insertion. B. Administering prophylactic antibiotics. C. Replacing the catheter every 48 hours. D. Encouraging increased fluid intake. The correct answer is A. Using sterile technique during insertion. Sterile technique during catheter insertion is essential to prevent introducing bacteria into the urinary tract. Question 13. A nurse is evaluating a patient's understanding of a low-sodium diet. Which food choice indicates the patient needs further teaching? Is it A. Grilled chicken. B. Fresh fruits. C. Canned soup. D. Steamed vegetables. The correct answer is C. Canned soup. Canned soup is often high in sodium and should be avoided in a low-sodium diet. Question 14. Which of the following nursing interventions is appropriate for a patient with difficulty swallowing? Is it A. Providing thin liquids. B. Encouraging the patient to eat quickly. C. Offering small, frequent meals. D. Positioning the patient in a supine position. The correct answer is C. Offering small, frequent meals. Small, frequent meals can help manage swallowing difficulties and reduce the risk of aspiration. Question 15. A patient with diabetes is experiencing hypoglycemia. What is the nurse's priority action? Is it A. Give the patient a glass of orange juice. B. Check the patient's blood glucose level. C. Notify the physician. D. Administer insulin. The correct answer is B. Check the patient's blood glucose level. Checking the blood glucose level is the first step to confirm hypoglycemia and guide appropriate treatment. Question 16. During a shift change, which of the following information is essential to communicate to the oncoming nurse? Is it A. Patient's family history. B. Patient's current vital signs. C. Patient's dietary preferences. D. Patient's hobbies and interests. The correct answer is B. Patient's current vital signs. Current vital signs provide critical information about the patient's immediate health status. Question 17. What is the best way to assess a patient's pain level? Is it A. Observing the patient's facial expressions. B. Asking the patient to rate their pain on a scale of 0 to 10. C. Checking the patient's vital signs. D. Reviewing the patient's medical history. The correct answer is B. Asking the patient to rate their pain on a scale of 0 to 10. A pain scale is a reliable method to assess the intensity of a patient's pain. Which of the following are symptoms of hyperglycemia? Select all that apply. A. Frequent urination. B. Increased thirst. C. Weight loss. D. Irritability. The correct answers are A. Frequent urination, B. Increased thirst, C. Weight loss. These symptoms are commonly associated with elevated blood glucose levels. Question 19. A patient is scheduled for surgery and expresses anxiety about the procedure. Which nursing intervention is most appropriate? Is it A. Provide detailed explanations about the surgery. B. Encourage the patient to express feelings. C. Administer anti-anxiety medication. D. Avoid discussing then procedure. The correct answer is B. Encourage the patient to express feelings. Encouraging the patient to express feelings can help reduce anxiety and provide emotional support. Question 20. When educating a patient on insulin administration, which of the following instructions should be included? Select all that apply. A. Rotate injection sites. B. Administer insulin into the same spot. C. Check blood glucose levels regularly. D. Store insulin in a freezer. The correct answers are A. Rotate injection sites, C. Check blood glucose levels regularly. Rotating injection sites prevents tissue damage, and regular blood glucose monitoring is essential for managing diabetes. Great job! Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with your fellow nursing students. Don't forget to subscribe and click the bell icon for more NCLEX practice questions and study tips. Good luck with your NCLEX preparation, and see you in the next video. Stay focused, stay motivated, and you'll soon conquer the NCLEX.